Coronavirus disease 2019, also known as Covid-19, is a contagious disease caused by severe acute respiratory syndrome coronavirus 2. The first known case was identified in Wuhan, China, in December 2019. The disease has since spread worldwide, leading to an ongoing pandemic. Symptoms of COVID-19 are variable, but often include fever, cough, headache, fatigue, breathing difficulties, and loss of smell and taste. Symptoms may begin 1 to 14 days after exposure to the virus. At least a third of people who are infected do not develop noticeable symptoms.
Dr. Aforo right here, the name you can trust. I've studied viruses for 15 years and consider many of them close friends. I have to say that this was the most recent. The virus in itself is an interesting specimen on close inspection. It resembles a revolving alien basketball rendered on PS2, which is biologically unusual.
Some people continue to experience a range of effects for months after recovery, and damage to organs has been observed. Multi-year studies are underway to further investigate the long-term effects of those diseases.
As to where it came from, there is a theory it originated from bats, although how it was passed to humans isn't clear, and the bats aren't talking, except in ultrasonic tones we cannot detect. The hypothesis is a man that had intercourse with a bat and got a bat juice in his pee-pee hole, which festered and took hold. We have tried replicating this in the laboratory with limited success because the bat keeps flying away.
Transmission of COVID-19 occurs when people are exposed to the virus containing respiratory droplets and airborne particles exhaled by an infected person. Those particles may be inhaled or may reach the mouth, nose, or eyes of a person through touching or direct deposition. The risk of infection is highest when people are in close proximity for a long time, but particles can be inhaled over long distances, particularly indoors in poorly ventilated and crowded spaces. In those conditions, small particles can remain suspended in air for minutes to hours. Touching a contaminated surface or object may lead to infection, although this does not contribute substantially to transmission. People who are infected can transmit the virus to another person up to 2 days before the symptoms show themselves. People who are infected can transmit the virus to another person up to 2 days before themselves show symptoms, as can people who do not experience symptoms. People remain infectious for up to 10 days after the onset of symptoms in moderate cases and up to 20 days in severe cases. Several testing methods have been developed to diagnose the disease. The standard diagnostic method is by detection of the virus, nucleic acid, by real-time reverse transcription polymerase chain reaction. To prevent the virus and its transmission include physical or social distancing, quarantining, ventilation of indoor spaces, covering coughs and sneezes, hand washing, and keeping unwashed hands away from the face. The use of face masks or covering has been recommended in public settings to minimize the risk of transmission. Several vaccines have been developed and many countries have initiated mass vaccination campaigns. Although work is underway to develop drugs to inhibit the virus, the primary treatment is symptomatic. Management involves the treatment of symptoms, supportive care, isolation, and experimental measures.